Now with a segment on chronic pain relief. Here's our reporter, Laura Windsor.
Chronic pain, whatever its source, can be a disabling condition, making every aspect of one's life an intense struggle. We spoke to Dr. Rob Kwok of St. Jude Medical Center in Fullerton to learn about the range of treatments available.
There's two different types of patients. Usually the more common one is patients who has had chronic pain for a long time and who's been managed by their primary care physician, who then would refer the patient to me after a sort of conservative therapy, meaning that their primary care physician has given them some medications, some physical therapy, and maybe heating pads or ice pads, or even some Western medicine involving acupuncture or herbal medicine. And then if the patient continues to have pain, then they're usually referred to me. Another type of patients are usually the ones that has doesn't have chronic pain, but it's more of an acute onset of pain, whereas sometimes they may have injured themselves at work, or they had lifted something heavy and one of their discs had herniated, causing acute type of pain. So those are usually the two types of patients I see. The St. Jude Pain Clinic consists of two physicians, one myself, and also an additional pain physician who is trained in physical medicine rehab. My staff includes registered nurses and medical assistants who are trained specifically with pain management. We can pretty much help just about anything. I think when it comes to pain management, there's two different types in terms of the management. One type is patient will come in with pain, and you whether do medical management or interventional procedures, they get better and you don't see them anymore. The second type of patients are the chronic pain patients, where they come in, we don't typically cure their pain 100%, but we use medical management, interventional procedures to try to minimize their pain so that they can go about their life a little more. There are extensive number of treatments, from medications to minimally invasive interventions that I've performed on a daily, weekly basis, as well as surgery. So it runs a gamut, depending on how severe their pain is, what the cause of the pain is, and what types of therapies the patient has undergone before they came and see me. A number of patients with actual chronic pain, not the acute pain patients, but patients with chronic pain who's had pain for many months, many years, who they have other psychological problems like depression, which is very common among this patient population. And what I intend to try to do, focus in my clinic, is when I do see these patients, I will try to encourage them to see a psychologist or psychiatrist to help them with the management of the depression. The good news is there is help out there, which modern pain management has evolved over the last decade or two to such an extent that there are a lot of options out there to help patients in pain. And once they've been evaluated and determine the extent of interventions that's been done, or the types of the physicians they've seen, there are other multiple options available for pain management so that they can return to their normal daily life.
If you are living with pain, it's time to ask your doctor about these new possibilities for a better life. I'm Laura Windsor for the American Health Journal.